guys, and welcome back to my channel. If it's the first time you're here, my name is borossy. First of all, I do apologize for the annoying voice. I have a stuffy nose going on. I just had some nose spray put in, so I'm hoping that this is gonna clear while I'm talking. It's super annoying. I apologize. I hope that you can look past that and talk about his heart and his kidney condition, because I feel like so many people have been wondering and I don't want you to have to wait any longer. So basically, when I was 20 weeks pregnant or around there with him, we had the big anatomy scan where you find out the gender and they go through all of the body parts and to look at all the organs to see if anything is coming back abnormal, or if they have anything wrong with them, or if you need to do further testing and that kind of thing. And that's happened in our case. They told us that he had two things that was alarming. They said that he has dilation on his kidneys, and they said that he had a white spot on his heart. And that scared us. We do have a history of kidney issues with our children. I was pregnant my first pregnancy, I had at the ultrasound, like around the 20-week mark, they discovered that our baby was sick, and we didn't know that it was a girl, but it was a girl, and she had cysts on her kidneys, and they were just expanding and growing out of proportion, and came with a lot of traumatic things. But basically she was not gonna survive, and we did not have a chance to save her. So we had to end the pregnancy in around, I was about 6 months pregnant with her when they decided that we had to terminate the pregnancy. So my two following pregnancies have been based off of protocol high-risk pregnancies, and they have been checking in on the babies every month with the ultrasound. Normally you get 3 in a pregnancy. You have one in the first trimester, one in the second, and one in the third. And for us, we have always been going in like once a month to check on them and to see how they are growing. Natalie's pregnancy was flawless. She had nothing wrong with her, nothing alarming, and everything was just smooth sailing with her. Great. This time around we did, however, have a bit of a scare. So when they told us that he had a white spot on his heart and dilation on his kidneys, it set off a few signals. Not only those two conditions by itself, it also told us that he had a higher risk of having Down syndrome or some kind of chromosomal abnormality. And they wanted to do further testing on me. They wanted to do the amniotic synthesis, I think it's called. Basically, it's a test where they test your amniotic fluid. They stick a needle in your belly, take out some of the fluid and test it. But we did not feel comfortable doing that. So what we did was we paid out of pocket to do the harmony test, which is a blood test that confirms if they have any chromosomal abnormalities. And that test can also tell you what gender the baby has. And I have videos of this, and you can find them very easily on my channel. I have one video that I say in the thumbnail, like, did they tell us the wrong gender? And that's the video where we get the results back, and for a brief moment we thought the gender was different. So if you want to have a little laugh, you can go ahead and check out that video, and you can also check out my 20-week pregnancy update with him, or this pregnancy with my son, to learn about what happened actually that day and how we reacted and all of that. So what they have been telling us the entire pregnancy is that the heart condition, they are not going to be able to tell us what it is until after he's born. So that's quite stressful. And the kidneys, they say we need to keep an eye on them, because the dilation can actually either get worse or it can get better by itself. And we were praying the entire pregnancy, and so many of you were as well, and thank you for that, because I feel like it has helped us in so many ways that you don't even know. So what happened was, during the pregnancy, the dilation on his kidneys were improving, slowly, but they were improving. So the dilation was reducing, so to speak, and that gave us comfort, and we felt a lot more at ease. However, when it came time to now check on his kidneys after he was born, we got the call that we had to go in to check on them, and they did like a little ultrasound on his abdomen and checking on the kidneys, and they didn't give us the result immediately. They said we will phone you with the results in a couple of days to tell you. And they called me and they said, we need you to come back in for us to give you the results. And only that was just a signal that something was not right, and that set off a very, very like big alarm clock in my head, and it got me very, very stressed, to the point where I was like thinking the worst, that, you know, I don't even know what could mean in the big picture, like if we would have to medicate him or give him, or if he needed operation, or I don't know the protocol of that kind of condition. I have no experience with that, so I was super scared when we went in. And when we came to the hospital, well, first of all, when we did the test, we got to go in together, all the family, so Caesar and I and our baby boy. But when we came back to get the results, they were refusing to let Caesar in, and I have a little clip of me in the waiting room, like being a little bit frustrated. I will try and insert that footage for you. What are you gonna say?
Jo,
Yeah.
nada.
We are on our way to the hospital. We have baby boy's second check after being born. He is now 2 weeks old, and today we have his first ultrasound, like scan on his kidneys, hoping that everything is good. I was reading the paperwork now from when we were in the hospital, and it said that his I think it's the left kidney that was dilated like 6 millimeters and the right 3 millimeters or something like that. So it has improved from when we learned about the problem, but they still want to keep an eye on it, and I want to comment and see if they have any like advice regarding, because he's always crying when he's making pee, and I don't know if that's related to the issue or if it's just something that every boys do because they don't like to get wet. I don't know, but he's very sensitive when it comes to wet diaper. If he has a wet diaper like more than 1 second, he will cry. But he's eating very well, and I don't think we have any problems with that. I do want to check his weight because I don't feel like he's putting on too much, but he's eating a lot, but he's also pooping a lot. So a few of those questions. Hello. We nearly had a little accident here. Anyway, so we're on our way to the hospital and hoping that we can pick up Natalie from school in time. We never know.
In time or on time?
On time, I suppose. I was wrong. My English is not the best. Or my grammar is not the best. It doesn't matter what language. That's the thing.
No sé si se dice in o on. No estoy seguro.
I think it's on time. In Swedish, I would use like similar to in time. But
What do you think, guys?
I don't know. Let us know down in the comments, because we are not English people, English speaking people. We are just trying our best here. But anyway, that's the little update for now. He is back here, and I have a mirror here where I can see his little face.
You look at me like I'm crazy when I shut my feelings out. You look at me like I'm different, still you stay cause you feel something real. Get so lost in my moments.
So we have come back to the hospital. I'm all flushed because I am super stressed and nervous. We had a scan on his kidneys 2 days ago. Caesar and I went together, and they performed an ultrasound on his kidneys, and they were supposed to call us yesterday with the results. And they called us and they said, you have to come tomorrow to the hospital to get the results. And I'm feeling a little bit stressed because I suppose that if nothing was wrong, then they would just have told me over the phone that everything looks great, don't worry. And now I'm here, and when we are trying to walk into the hospital, the guard in the door stop us and say that Caesar is not allowed in, or they are saying that only one of us can go with the child. And of course I want to go because I don't want to leave him alone if he needs to eat.
but also I'm more limited with my language. I speak Spanish and I understand most of the things, but the medical terms for me is quite difficult. It's not something I have studied, it's not something that I know. So of course I want Caesar to be here, and obviously if they have bad news I want him to be here for support. And I could hear him protesting outside, and he had 2 guards stopping him at the end, and this is just ridiculous. I'm sitting here alone in a room and I don't understand why he can't be here with me when we are taking the precautions. It's something super stupid. And if the hospital were over saturated or whatever, I can understand that they don't want to let in many people, but now we are in an area of the hospital where nobody's at, and I don't think there would have been more problems for them if he were to sit here next to me. It's just a stupid rule, and I don't agree. I don't know. I have to wait. Now it's about, what time is it? 12 past 1, and I have the appointment at 1:30. So we shall see if he wants to eat soon or what. But I will give you an update on what they say after.
But yes, as you can see, I was very emotional in that clip, and in the end Caesar got to come in because obviously I don't understand enough to feel comfortable getting all the information by myself. But basically they said that one of the kidneys, I believe the dilation on the kidneys when he was born was at a 3 and a 5. And they checked on him, and the day we got the results they said that the one that had the more dilation had almost completely gone. It had completely reduced by itself, but the kidney, I believe was the left one, who had only 3 millimeters of dilation, was now up to a 7, which is quite alarming. That's a little bit more than they would have liked, but because the other one was completely back to normal, they said not to worry, and they said basically live life as normal. We don't have to do anything other than, I will get to that, but they said to come back in 6 months to keep an eye on it, and they said if he were to get sick during this time and if he gets fever, we need to take him into the emergency to check that he don't have or our medical center here near is enough to go in for them to check to see that he don't have a urine infection. And she said if they test him positive for urine infection, I need you to come to me here in the special where they specialize in these kind of things, and she would do further testing and to check on that, because obviously if you have dilation on your kidneys, having a urine infection could be quite dangerous, and because he's so tiny we don't want him to have any problems with that. So that's something that we have to look out for, and obviously is stressing me a little bit because I have my daughter in school and it's normal for them to bring home small illnesses, viruses or whatnot. So we are taking care, we are trying to be very careful, but yeah, that's basically all I know now. So next thing, his heart condition. We have been waiting until recently. We went in last week, I believe, to check on his heart, but if I remember correctly, they put a lot of electromagnetic things, I think, on him. He had 6 of them spread out on his chest and his belly, one on his wrist and one on his leg, and to measure his heartbeats and all of that. And the doctor told us that his heart was measuring perfectly, his heartbeat was very stable, and there was nothing wrong with that. And she said that when she was listening to his heart, there was no sounds or anything that could be alarming. So everything, the function of the heart is great. But when she did do the like the ultrasound or similar to the heart, where she could actually watch what was going on. She explained to us, and it's quite difficult for me to explain, so I will try my best. But basically the heart, if you imagine this to be the heart or this to be the heart, you have tendons that goes diagonal in your heart that helps the heart to beat. And if you imagine the tendons doing this to the heart, and they should be going diagonal, and I don't know how many they are, but one of them is not going, actually instead of being attached from up to down, it's going over the other ones and attached to the side. So when the heart is doing this, also is pulling a little bit to the side. And she said that it was not affecting the heart. What could have been is that the blood flow could have been going through easily, but more difficult when it started to go back again. But in his case, that's not happening. So we are very grateful and very happy to hear that that is not going to affect his heart or his blood flow in any way. She said it's just something unique for him, and in the future don't be scared that it's going to cost anything like other problems in the future. She said, I'm not gonna need to see you again. Now we are aware of what is abnormal with his heart, and that's enough for them. So basically the white spot that we saw when they were doing the ultrasound on me was the tissue being so thick because of the tendons not going this way but go overlapping the other ones. When they were watching it from outside, it looks like there was extra tissue that they could not explain, and that's why there was a white spot, or a spot that was illuminating more during the ultrasound. So that's good news. He has a strong, healthy heart. It's just built a little bit differently from yours and mine. So he's very unique, and that two things I felt was super important to really go over with you guys in today's video, because I want to be able to refer back to this video if I get questions in the future. But yes, in six months more we will be going back to check on his kidneys, but as of right now he's healthy. We don't need to do anything specific, we just need to keep an eye on him, and that's all. So
You look at me like I'm crazy when I shut my feelings out. You look at me like I'm different, still you stay cause you feel something real. Get so lost in my moments, doesn't mean I don't need you. I fell in love with your colors, they kinda tell me what I'm thinking. Fell in love with the way we are and the way we lose it. There's something different